Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cortical Adrenal Gland Disorders. Introduction. The adrenal glands are found on top of each kidney. The adrenal glands make very important hormones that you can't live without. There are many disorders that can affect the adrenal glands. Treatment for adrenal gland disorders depends on the cause. Treatment may include surgery, medicines, or other treatments. This program discusses problems seen in the cortex of the adrenal glands. It will help you better understand disorders that affect the adrenal glands. It talks about common disorders of these glands. It also covers treatment options. The adrenal glands. The adrenal glands are found on the top of each kidney. Kidneys are organs located in the mid to lower back on both sides of the spine. Each kidney has one adrenal gland, which is shaped like a triangle. The adrenal gland is divided into a superficial area called the cortex and a deeper layer called the medulla. The cortex makes very important hormones. Some of these hormones are cortisol, aldosterone, testosterone, estrogen. Cortisol helps the body use glucose, a type of sugar found in the body. It also helps manage the body's use of protein and fat. Aldosterone helps control the balance of water and salt in the body. It also helps keep blood pressure normal. Testosterone causes the body to have male sex characteristics. Some examples are facial hair, a deep voice, and muscle growth. This hormone is mainly made in the testes. Some is also made in the adrenal glands. Estrogen causes the body to have female sex characteristics. One example is growth of breast tissue. This hormone is made in both the adrenal glands and the ovaries. General symptoms. Many cortical adrenal gland disorders have similar symptoms. Common symptoms are tiredness and muscle weakness. Other symptoms of cortical adrenal gland disorders are a lump in the abdomen, high or low blood pressure, high or low blood sugar, increased thirst and urination, irregular or no menstrual periods in women, pain in the abdomen or back, weight loss or gain. Some cortical adrenal gland disorders may also cause a lump of fat on the back of the neck with a round, full, red face, acne, balding, easy bruising, patchy or dark skin, upper body obesity with thin arms and legs. Other symptoms may include a deepening of the voice and swelling of the sex organs or breast tissue, growth of fine hair on the face, upper back, or arms, irritability, anxiety, or depression, lower sex drive. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early is important. It makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Cushing syndrome. Adrenal disorders can affect your hormone levels. They can cause your adrenal glands to make too much or not enough hormones. With Cushing syndrome, there's too much cortisol in the body. Cushing syndrome is rare. It mostly affects adults aged 20 to 50 years. People who are obese and have uncontrolled type 2 diabetes have a higher risk of getting the disorder. Cushing syndrome can be caused by certain tumors that cause your body to make too much cortisol, taking synthetic hormone medication that contains cortisol. This medicine may be used to treat an inflammatory disease. Rarely, Cushing syndrome may also be caused by an inherited disorder. This disorder causes tumors to grow on glands that control hormones in the body. If it is not treated, Cushing syndrome can cause health complications such as bone loss, diabetes, frequent infections, high blood pressure, loss of strength. Treatment for Cushing syndrome depends on the cause. If synthetic hormones cause the disorder, a lower dose may control symptoms. In other cases, the medicine may be changed. If Cushing syndrome is caused by a tumor, surgery may be done to remove the tumor. Other therapies may also be needed. Most of the time, Cushing syndrome can be cured. Addison's disease. With Addison's disease, there is too little cortisol in the body. In some cases, there is too little aldosterone as well. Addison's disease happens when the cortex of the adrenal glands are damaged. This damage stops the adrenal glands from making enough hormones. Addison's disease affects all age groups and both genders. It can be life-threatening if it is not treated. In most cases, Addison's disease is caused by a problem with the immune system. The immune system attacks the body's own tissues or organs by mistake. This causes the adrenal glands to become damaged. A bacterial infection called tuberculosis or TB may also damage the adrenal glands. TB usually affects the lungs, but it can also damage other parts of the body. In some cases, it can damage the adrenal glands. This can lead to Addison's disease. TB is more common in developing countries. Rarely, Addison's disease may be caused by amyloidosis, bleeding into the adrenal glands, certain severe long-lasting infections, genetic defects such as adrenal glands that do not develop normally, surgical removal of the adrenal glands. Treatment for Addison's disease includes hormone replacement therapy. This is to provide the hormones the body isn't making. You will need to take hormone pills for the rest of your life. Your healthcare provider may also tell you to increase your salt intake. This is very important when you are exercising, in hot weather, in stressful situations. Some people with Addison's disease may have an Addisonian crisis. This requires treatment right away. Seek emergency medical attention if you have loss of consciousness or fainting, low blood pressure, pain in the abdomen, low back or legs, severe vomiting or diarrhea. Cancer. Problems with the adrenal glands may also be caused by cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them, replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancer, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names. These names depend on where the cancer started. Cancer that begins in the adrenal glands will always be called adrenal gland cancer, even if it spreads to other places in the body. Adrenal gland cancer is a rare type of cancer. A tumor in the adrenal gland may be functioning or non-functioning. If the tumor is functioning, it makes more hormones than normal. If it is non-functioning, it does not make any hormones. The hormones made by functioning tumors may cause symptoms. Having certain genetic conditions raises the risk of getting adrenal cancer. Genetic conditions are caused by defective genes passed on from parent to child. Genetic conditions can also be caused by a mutation or change in a certain gene. Conditions that raise your risk are Li-Fraumeni syndrome, Beckwith-Wiedemann syndrome, Carney complex. Treatment for adrenal gland cancer may include surgery, radiation therapy, and chemotherapy. Often, some combination of these treatments is used.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The adrenal glands are found on top of each kidney. Adrenal glands make very important hormones that you can't live without. There are many disorders that can affect the adrenal glands. Common disorders are Cushing syndrome, Addison's disease, adrenal gland cancer. Treatment for adrenal gland disorders depends on the cause. Treatment may include surgery, medicines, or other treatments. It may also include radiation therapy or chemotherapy if the cause is cancer. Talk to your healthcare provider if you notice any abnormal changes or symptoms. Finding a problem early makes its treatment easier in most cases.
Thank you for using Explain.